Thank you, Dr. Harris. Next, allow me to introduce you to Dr. Penny Kris-Etherton, who will speak to us about the role of nutrition on cardiovascular health and disease and aging. Dr. Kris-Etherton is a distinguished professor of nutrition in the Department of Nutritional Sciences at the Pennsylvania State University, where she has been on faculty since 1979. Her research expertise is cardiovascular nutrition, and she conducts controlled clinical nutrition studies designed to evaluate the effects of nutrients, bioactives, and dietary patterns on risk factors for cardiovascular disease.
Thank you very much. Let's see, somebody made the comment that nobody here was born before 1979. Okay, so I'm going to just briefly go over some of the major risk factors for cardiovascular disease in children and adults and what's happened over time. And then the heart of my talk is looking at the relationship between CVD risk factors in children and CVD risk later in life. Doesn't matter at all. Then I'll turn our attention to looking at diet quality and cardiovascular health, both in children and adults. And so you've heard from a number of speakers that cardiovascular disease is a leading cause of death in the United States for both men and women. It accounts for about 800,000 deaths yearly. And then you can see that cancer is the second leading cause of death. And then there are other causes as well, but cardiovascular and cancer account for much more deaths. So in terms of atherosclerosis, I think it's just important to appreciate that it is a chronic disease, and it starts right from birth. And you can see that it's chronic progressive disease, and events are manifested from the fourth decade on. But it does start early on. And this slide basically shows prevalence of cardiovascular disease in adults greater than 20 years of age, and it clearly shows, the chronic progression of this disease. But still, even though 85% of adults 80 years and older have cardiovascular disease, 50% are third to 40% of the population between the ages of 40 to 59 have this disease. There are modifiable and non-modifiable risk factors for heart disease, and I think that you're well aware of these. What's really important relative to nutrition is that nutrition can modify lipids, lipoproteins, blood pressure, diabetes, overweight, obesity, as well as thrombotic factors. So nutrition plays a key role in modifying risk for coronary heart disease. So now I just want to spend a little bit of time talking about risk factors, how they affect the disease. We've learned a lot from Framingham, and basically this slide shows in people at the same age across the board that changing these risk factors really increases risk of heart disease, so that a low HDL, high total cholesterol, increase in blood pressure, smoking, and diabetes can markedly increase risk of cardiovascular disease in both men and women compared to people who don't have these risk factors. So let's look at trends in serum total cholesterol among adults greater than 20 years of age. And what we see is that in all ethnic groups, there's been a decrease from 1988 to 2012. That's great. But despite that, in practically all ethnic groups, we see that anywhere from about 36% to almost 50% have LDL cholesterol levels, serum total cholesterol levels that exceed recommended levels. With children, we've seen decreases in cholesterol over the years from 1988 to 2012 in all ethnic groups. This is very good news. But even despite this, turning your attention right here to the right-hand side of the slide, what we see is that about anywhere from about 10% or so, or even a little bit higher, of all children. Ages 6 to 8, 9 to 11, both boys and girls have high LDL cholesterol levels. You saw this slide from Tammy just previously, and it's just amazing to me to know that about 80% of our population over the age of 75 has high blood pressure, but then, in midlife, between 45 and 54, about a third of our population has high blood pressure. But it's one of these chronic conditions that increases with age. And with obesity, we've all seen these results a lot. The slow, steady increase in obesity, both in men and women, until 2012. The very latest data that were just published report that 40% of women in the United States now are obese. And in US children, what we see is the trends are exactly the same as they are in adults. And you can see here that about 20% of children 12 to 19 years of age are obese. And, in the 2 to 5 year range, you can see that, around 10% or so are obese. It's quite alarming. And then what we see is that in younger children, between the age of 2 and 5, this is what the obesity rate is over time. There's a decrease here, which is great. But then in the older age groups, between 6 and 11 and 12 to 19, there's a jump. So these kids then are moving into, the obesity range from, early life to very early life to, young years, 6 to 19. What's happening with diabetes? Well, you can see a sharp increase starting around 1997, and now about 22% of the population has diabetes. And then a recent study showed an increase in diabetes among children and adolescents from 2001 to 2009. So in 2001, this was a prevalence 0.34 per 1,000 children. And then in 2009, it increased to 0.46 per 1,000 children. So that's about 1 child in 500 has type 2 diabetes now. And then you can even see in the SEARCH study, which is funded by CDC and NIDDK, looking at the prevalence of diabetes in the United States and the clinical course of it, what we see is that there's an overall increase in children, both in females and in males, and we see an increase in the 10 to 14-year-olds, the 15 to 19-year-olds, and increases in all ethnic groups. And look at what's happening with Hispanics, huge increases. We don't see a statistically significant increase in the Asian Pacific Islanders, but again, in all other ethnic groups, we do. So an uptick in type 2 diabetes in children. So now you're going to be hearing more about obesity. We've learned a lot from the Bogalusa Heart Study, and I'm going to be talking a lot about this as we go along. But basically, this is a relationship of childhood BMI to adult obesity. And you could just look at BMI in childhood between the 0 to 49th percentile. And these are kids between the ages of 12 and 13. And you can see that there's, a low risk of becoming an obese adult. But, as BMI increases in children, then we see that risk of adult obesity really increases. And so you can see here, kids that are in the 99th percentile at the age of 12 have 100% chance of becoming obese adults. So real close correlation there. And this is basically another way to look at it, but it's BMI at age 22 and BMI at age 13, and you see a strong correlation here, and a relationship with insulin resistance as well, as would be expected. But it's just amazing to see this correlation between the ages of 13 and 22, just in 11 years. So this is a very interesting study that looked at 4 different studies that were done with children and relative risks of various outcomes. And these are risk factors for cardiovascular disease related to obesity in children. So 2 of these studies, Bogalusa muscatine, were done in the United States. This cardiovascular determinants in adult health was done in Australia, and the youth FIN studies were done in Finland. And basically we see that obesity is significantly related to all these really bad risk factors for cardiovascular disease, including type 2 diabetes. You see statistical significance there. I'll just go down the list: hypertension, high LDL, low HDL, high triglycerides, and increased coronary intima media thickness. Just obesity in and of itself in childhood from these 4 studies are associated with increased risk of increased risk factors for cardiovascular disease. And in the Bogalusa Heart Study, basically they took people who had high intima media thickness and low intima media thickness as adults, and then looked at their BMI when they were children. And basically, BMI in children was correlated with IMT in adults, in both men and women here. And you can see here, BMI by age for persons with high or low levels of carotid IMT levels in adulthood. So again, obesity in children was related to intima media thickness in adults. And then in this study here, basically it's showing a correlation between childhood LDL cholesterol and adult LDL cholesterol. So I just want to focus on this. This is from Bogalusa. And basically, if a child had a high LDL-C, as an adult, they have a 40% chance of having a high LDL-C. So we see a tracking of lipids and lipoproteins in children well into adulthood. So in the cardiovascular risk in young FIN study, this is interesting because it looked at risk factors that were related to IMT measured 21 years later. And basically, they showed that these were the risk factors that were related to IMT thickness. And of course, age is a factor, but high LDL cholesterol, body mass index, and systolic blood pressure, smoking as well. And so that these risk factors in childhood predicted IMT thickness 21 years later. And so I think this is really interesting as well because it's from the cardiovascular risk in young FIN study. This was done in Finland. They looked at number of risk factors in childhood and IMT thickness. And then these are risk factors in adulthood. And what we see is even with no risk factors in adulthood, that children who had 2 to 4 risk factors had a higher IMT 21 years later. Pretty amazing, the relationship between childhood risk factors for cardiovascular disease and coronary artery disease 21 years later. And so this basically shows the same thing, but this is in kids 12 to 18 years of age, and it's just showing that risk factors in childhood are related to intima thickness in both men and women. And these are risk factors in kids 12 to 18. And look at kids 3 to 9. So in kids 3 to 9, if they had 2 to 3 risk factors at ages 3 to 9, the men, 21 years later, had increased carotid intima media thickness. So even in young kids, these coronary risk factors take their toll later in life. Whoops. And so that from Bogalusa Heart Study, we see that LDL levels are predictive of IMT thickness, and of course, adult LDL levels are predictive of IMT thickness. And so from the Bogalusa Heart Study, what are risk factors that predict IMT since childhood? And basically, here they are. Look at children. It is body mass index, systolic blood pressure, and LDL cholesterol. Major risk factors in childhood that are predicting carotid IMT thickness in young adults. So, something that we really have to pay attention to in children because it's taking their toll. It's taking its toll in increasing risk of cardiovascular disease in adults. So let's turn our attention to diet. I have about 5 minutes left. And I think this particular figure depicts the importance of lifestyle risk factors in contributing to the development of cardiovascular disease. And we can see at the base of this pyramid is dietary habits, physical activity, and cigarette smoking. And so that poor lifestyle behaviors then contribute to major risk factors for cardiovascular disease that lead then to events and death. So if we can do something at the base of this pyramid, we can really do a lot in terms of decreasing cardiovascular disease, morbidity, and mortality. And in fact, the Global Burden of Disease study basically showed that dietary risks are the #1 cause of preventable mortality. And what I find amazing is that dietary factors predict overall mortality more so than other lifestyle behaviors like smoking and others too. So diet is so important here. And how are we doing? Well, this particular slide shows the 7 metrics of cardiovascular health, as you can see here on this slide. And one of them is a healthy diet score. And the red means that it's poor, yellow means that it's intermediate, and green means that it's ideal. And these are the cardiovascular risk scores for children, 12 to 19 years of age. And you can see that out of all these metrics, diet is the worst. We're in the red the most with diet. And only 0.5% of the population of our children have a good diet. And so in terms of adults, in terms of diet, over the years, you can see that we are getting better. Okay, so in 2003 to 2004, only 0.7% of the population had a good diet. And now in 2011 to 2012, 1.5% of the adult population has a good diet. But still, is that good enough progress in that period of time just to see about a 2-fold increase? And still, what we're saying is, a lot of the population really still does have a poor diet. And we see the same thing with children. We see that over time, the diet has improved a little bit, but still we have a long, long, long way to go. So in terms of cardiovascular disease incidence, according to number of ideal health behaviors, you see the relationship here. And we want everybody to have at least 3 to 4 of those metrics in check. And you can see that doing that, markedly decreases risk of cardiovascular disease compared to having those metrics out of whack. Okay, this slide shows the prevalence of meeting greater than 5 criteria for ideal cardiovascular health. And take a look at children here. That kind of looks pretty good compared to adults. but yet we could say that over 50% aren't meeting at least 5 criteria for ideal cardiovascular health out of those 7 metrics that I showed you. I think I'm just going to skip over these 2 because we talked about the diet improving. So let's take a look at children's diets, 5 to 11 years of age. And this is the prevalence of meeting the goal for individual components. And what we see is, not even 50% are meeting targets for sugar-sweetened beverages. And we're way far off with sodium, whole grains, fish, fruits and vegetables. So we have a long way to go to improve diet to benefit cardiovascular disease risk factors and cardiovascular health in later life. So the sugars paper in children just came out from American Heart Association. This was published in Circulation. And you can see how much sugar our children are eating. And the 2 to 5-year-olds are consuming 200 calories a day in sugars. And you can see adolescent boys are consuming 429. And so this is one place where we can really have an impact. So in summary then, where are we? Okay, I hope I've shown you how important it is to control cardiovascular risk factors in children to lower CVD risk in adulthood. And a healthy dietary pattern is important for managing CVD risk factors throughout life. And as you saw, the present U.S. diet for both children and adult has a long way to go to be what we would consider good and in terms of benefiting cardiovascular health. With that, I thank you very much for your attention.